Hello, good morning, you beautiful people. And thank you very much for me and Amma for this amazing talk. And to be honest, I had a big inspiration and many thoughts looking at what you were saying. And well, first of all, my wife is Brazilian and I am Eastern European. And I hope that our children will experience that personalized approach to healthcare with personalized metabolomics and healthcare outcomes, and we'll have a era where paracetamol dose will be, 855 milligrams for one person and 735 to another. But talking about the health policies and the talk I'm going to deliver now, from the perspective of what Amr was talking just now, I realize how important it is to have the tailored health policies to every single individual. And unfortunately, so with the Red Drop, we created opportunity for people to have accessible healthcare, to have access to health screening. Unfortunately, we are not providing motivation, and we might have psychiatrists on board in future. But with our approach, myself, I'm 37, and all my life I had normal BMI, and I'm not from the population which is at risk of metabolic disorders or at risk of diabetes. Nor I have family genetics. Yes, I have cardiovascular disease in my family history. I tested myself using the test kits we are providing, and I discovered that my cholesterol was high, which was absolutely surprising for me because I lived healthy lifestyle all my life. But with this information accessible for me, and having opportunity to track my health and my numbers, I was able to increase my exercise. So let's say we were talking about, Amr mentioned that some of the people genetically will be overweight and obese. However, person who is overweight but exercising an hour a day will be healthier or is likely to have cardiovascular disease rather than a person who is at a higher level or upper level of his BMI, but lives sedentary lifestyle. So let's start our talk about health policies and healthcare management. So it is absolute pleasure for me to embark on this amazing journey of healthcare policies with you today. Now, I hope that you find this as exciting and entertaining as I do. And I hope that this exploration of how to keep our communities healthy and thriving is inspiring to you. So let's kick off things with a little bit of etymology. So the word policy started back in ancient Greek era. And I believe that many of you knows who is this person, and those of you who knows how to read Cyrillic probably has a clue already. So the policy was starts from the ancient times of Greek philosopher Hippocrates, who's also hailed as a father of medicine. And Hippocrates, known for his famous Hippocratic oath, recognized the importance of public health back in those days, and he understood that the well-being of an individual goes hand in hand with the well-being of society. So this historical example serves a powerful testament to the enduring significance of public health policy. Now, let's fast forward to our present times, where we find ourselves grappling with the aftermath of the global pandemic. So COVID-19 has shaken the world, reminding us of the crucial role of public health policy and the policy which plays significant role in safeguarding and fostering resilient communities. Now, there is a few key policy responses mentioned on the screen, which were developed throughout the pandemic as an emergency response. It was a wake-up call to all of us, and wake-up call which demands our attention and underscores the growing focus of public health policy and health management. Now, public health policy has come a long way since its inception. We've witnessed transformative shifts from a purely treatment-focused models to models which embrace prevention and population health. It's like swapping Band-Aids with a suit of armor. So this evolution has taken into account a broad range of factors throughout its development, such as social determinants, environmental influences, and pursuits of health equity, which I will talk about later. For instance, all you know that non-communicable diseases such as cardiovascular disease, diabetes, and cancer are leading causes of death worldwide. So in the UK, these diseases are accounting for up to 90% of all deaths. So this statistic highlights the pressing needs to address non-communicable diseases through effective public health policies and health management strategies tailored to international and local contexts. Now, let's talk about our heroes of the healthcare systems, health managers. So these individuals possess unique sets of skills that keep the gears of healthcare turning smoothly. They are the conductors of the symphony, ensuring that all the moving parts move in harmony and work in harmony to ensure the effective and efficient healthcare delivery. In the United Kingdom, approximately 13.6 million people are living with at least one long-term condition, such as heart disease or diabetes. Health policies, which is one of the recent health policy development for NCDs, as an example on this screen, play a vital role in coordinating healthcare, implementing preventative strategies, and facilitating patient education to manage these non-communicable diseases effectively. And that was mentioned in our fireside talk just now. These policies contribute to improving health outcomes and reducing the burden on health systems. So public health challenges are complex and multifaceted, requiring collaborations across different disciplines. It's like putting together a jigsaw of puzzle, taking pieces from different boxes. Public health policy and healthcare management must join forces with healthcare professionals and researchers, with community leaders and policymakers, and with other stakeholders, including industry, to make sure that there is a meaningful change achieved. However, the most important person and the most important piece of that puzzle here in the center is the patient itself on a personal level, which is quite often forgotten at the level of development of healthcare policies. Imagine this, on an international context, multiple countries face the challenge of rising obesity levels among their populations. To address this issue, international organizations such as World Health Organization collaborate with governments, with health ministries, with nutritionists, with fitness professionals to develop evidence-based models and policies and interventions. By sharing best practices and lessons learned, these collaborative efforts have the potential to reduce the prevalence of non-communicable diseases globally. And that's why we are all here. Now, health inequalities, which I mentioned earlier, are the pressing challenge that demands our attention. They represent disparities in health outcomes that persist among different communities and populations. However, they also present us an opportunity to make a lasting difference by championing health equity. Consider this eye-opening fact. In many low and mid-income countries, individuals from marginalized communities experience significantly higher rates of non-communicable diseases compared to their more affluent counterparts. And to be honest, we don't have to go far. In the UK, for example, there is notable differences between different socioeconomic groups. But public health policy and health management must proactively address these disparities by implementing targeted interventions, increasing access to care, and advocating for policies that promote fairness and social justice both at home and on international levels. So now, welcome to a digital age, where technology and data open up the world of possibilities for public health policy and health management. It's like having superhero toolkits here. So let's have this intriguing example. So imagine that there is an international initiative which utilizes all mobile health applications and healthcare and wearable devices to monitor, manage, and track non-communicable diseases. And I can see that there are so many examples throughout those 3 days created by you. So these technological advancements empower individuals to take control of their health, while also providing valuable data to inform public health policies and interventions. By harnessing technology and data, we can bridge the gaps in healthcare access and improve the healthcare outcomes on international levels. And last, but certainly not the least, let's talk about preparedness and resilience. So the events of the past year have taught us the importance of being proactive and building resilient public health systems. It's like having a sturdy umbrella when the storm comes. So consider this fact. According to WHO, non-communicable diseases account for 71% of global deaths. And low and mid-income countries bear the highest burden. NCDs could cost the global economy of up to $47 trillion by the year 2030. And there is a few very interesting facts about what investment is required on the level of prevention. By investing in preventive measures, early detection, and robust healthcare infrastructure, countries can enhance their preparedness and resilience against the rising tide of non-communicable diseases. The proactive approach here is crucial to ensure the well-being of individuals and communities. And in conclusion, the growing focus on public health policy and health management serves as a beacon of hope in a world that grapples with complex health challenges. By embracing interdisciplinary collaboration, harnessing the power of technology and data, and addressing health inequalities, we can create a brighter and healthier future for all. So let's just stand together and seize the opportunity to shape the world where the health and well-being are valued and protected at the highest level. Thank you.